always from top to bottom. What is the topmost? Nose. Конечно, nose. So we have to see if there are changes in the nose form, if the breathing is free through the nose, and if there are some fluid from the nose, mucus or pus or blood or something else. Then we have to look at the larynx. Without laryngoscope, we cannot see into the larynx, but we can see outside the larynx. We have to see if the form is not changed and if there is no deviation to the left or to the right. At this moment, we also evaluate the patient's voice. High-pitched, low-pitched, or some... Что это такое? Как? Рэпс? Как? Coarse?
Я не могу говорить, потому что я хриплю.
Что это такое? А? Но это не висен, но нет. Чего? Хаш? Ну хорошо, хаш. Понятно? Понятно. Дальше. We have to look at the chest of the patient. The chest. We have to see the size of the chest. Sagittal and transversal size. And the relation between them. Here, the sagittal size is about 50% of the lateral size. This is characteristic for asthenic patient. Asthenic. Thin, huh? Asthenic patient. Also, we have to see for the position of the clavicle and ribs, if they're going horizontal or down. If the intercostal spaces are wide or narrow, if the chest form is symmetric, or one part is decreased, or one part is enlarged. If the breathing of the patient is symmetric, please breathe deeply, more deeply. We can see if the breathing is symmetric, or maybe one part is decreased in breathing. Then we can see the costal angle. Costal angle. Here. If you place your fingers along the costal arc, you can see the angle. Нет. And this angle is less than 90 degrees. This is also characteristic for asthenic patient. We have to see if these spaces are bulging or excavated. And we have to see the circumflex, circumference of the chest. In my room I have a special device for this. Here, under the angle of scapula, here, on the level of the fourth intercostal space, we measure the circumference of the chest. Then we ask the patient to breathe in, breathe out deeply, and measure by expiration, and then breathe in deeply, and we see the breathe. The thoracic expansion of the chest. Sorry, the breathing expansion of the chest. Understand? You can see the breathing expansion of the chest. Is this understandable? Good. Maybe something else by inspection, but this is the most important and the most common. After inspection, what